Welcome to the Healing Pain Podcast with Dr. Joe Tatta. Each week, we interview top experts in physical therapy, pain science, and integrative pain care. You'll learn the most up-to-date information for treating and reversing persistent pain. This podcast is for educational purposes only and not intended to be used as personalized medical advice. And now, here's your host, Dr. Joe Tatta.
Hey there, friends. Welcome to this week's episode of the Healing Pain Podcast. Today, we're discussing how to train entry-level physical therapists to address the opioid epidemic. My guest this week is Dr. Swisher. She is professor and director of scholarship for the West Virginia Division of Physical Therapy. She's been a board-certified cardiopulmonary clinical specialist for 20 years and has taught in the area of cardiopulmonary physical therapy, exercise prescription, and pathophysiology. She's also a Catherine Worthingham Fellow of the American Physical Therapy Association and has published over 80 peer-reviewed publications. On today's episode, we focus in on a recent paper Anne published called The Physical Therapist's Role During the Opioid Epidemic in Rural Appalachia, Preparing Students to Educate Communities. Anne is working to address opioid misuse in what some may consider an unconventional way. She's enhanced physical therapy instruction at West Virginia University to emphasize the physical therapist's role in preventing and treating opioid use disorder. The reason why this is such an important topic is because the nexus of America's opioid epidemic isn't where most people would expect. It's not in the big cities such as New York, Chicago, or Los Angeles. Instead, the hub of the epidemic is in rural states such as West Virginia. West Virginia has more than double the rate of opioid deaths than the national average and a 20% higher rate of opioid prescriptions written by providers. On today's episode, we discuss how to prepare future physical therapists to embrace advocacy roles related to opioid use disorder, the educational model Anne developed to guide physical therapy students regarding their roles across the spectrum of opioid use disorder, and how this model can serve as a guide for educating a variety of communities negatively impacted by the opioid epidemic. Okay, without further ado, let's begin. Let's meet Anne and learn how we can train entry-level physical therapists to address the opioid epidemic. Hi there, Anne. Thanks for joining me this week.
Well, hi, Joe. It's nice to be here. Thanks for inviting me.
As I was doing my rounds looking at journals, there's an early publication of a paper that you and some colleagues worked on, and I wanted to invite you on the podcast and thrilled that you accepted so we can talk about this important topic. I want to point people toward the paper first so they can read it, especially if they're physical therapists or maybe potentially other healthcare professionals. But the name of the paper, which appeared in the 2021 PT Journal, is called Physical Therapist's Role During the Opioid Epidemic in Rural Appalachia, Preparing Students to Educate Communities. So obviously the paper is talking about the role of physical therapists in the opioid epidemic. There's been a lot, I would say, with regard to the prevention and how PT plays a role in prevention. But this paper really went a whole lot deeper and gave lots of good direction for academics and those in clinical practice, and I think CIs even, and students kind of going out into the field. I guess first tell us why you decided to take this topic and obviously write about it.
A couple of things that probably started me off from the very beginning. One is being a lifelong West Virginian and working at an institution that has very deep roots within West Virginia and Appalachia. Anything that affects my state and my people gets my attention. And West Virginia has unfortunately been very badly affected by the opioid crisis and the epidemic. And so that desire to do as much as we can for the people that are affected. But even looking back historically as a cardiopulmonary clinical specialist, I've spent a lot of my career working with people who have cystic fibrosis. And I was starting to see those patients that as they got into adulthood had pain complaints, as most adults do, your typical back pain and other kinds of things, really not disease related, but they were getting prescribed opioids, which as respiratory depressants is one of the worst possible drugs that I would want those patients to be on. And not only were they being prescribed these medications, but they were, I was starting to see signs of addiction, even in that population. So that probably was, really the beginning of it. Like, oh my goodness, these drugs are really problematic, even in that population. And then I've been working more recently with our cardiovascular surgery ICU patients and finding that addiction and the behaviors that that's led to has led to those people requiring cardiac surgeries that they didn't before, and then the problems of managing their pain. If they already have addiction, then what kinds of pain medications? So it became really a challenge within my area of expertise. And then as a educator, then, was it that chance to sort of look across all aspects of clinical practice and say, okay, where are we really preparing ourselves and our students as clinicians in all of these different aspects of pain, of chronic pain, of the psychosocial and emotional issues of pain, and how this really seems to be a bad direction. So long story short, that's kind of how I got started.
It's a great story and a great way to start our episode here today. And like yourself, I'm working in the state of New York. I've been a PT since '96, and probably like most professionals who've been practicing for a couple of decades, we've noticed the use of opioids increase. And like yourself, for me, I noticed it specifically after back surgery, particularly OxyContin. That was popular. You're seeing it in cardiopulmonary, cardiovascular complications. You mentioned West Virginia as, all of us today, I think as professionals, we can identify certain states, West Virginia being one of them, that was kind of a hotbed of activity for the opioid epidemic. I'm just curious, was there a sense amongst you and your other colleagues that this is really, so you mentioned you noticed it yourself, but was there chatter kind of in our profession or interprofessionally in the state as to, hey, we're seeing a tremendous amount of opioid use, misuse, and we really should start to pour some attention toward it, so to speak?
Yeah, absolutely. I think it got attention on a lot of levels, from physicians and pharmacists, but really then finding that, especially in small rural communities, it really impacts everything.
Mhm.
And even our students were coming in and coming from those communities, and we would teach the basics of a pharmacology or something, or signs of addiction. They say, do you know anybody who's had been affected with it? And most hands in the classroom would go up.
Mhm.
Someone in their family, someone in their community, directly affected by this. So I think it really kind of came back to us. And then in the health professional realm, as we were seeing that there were a lot of initiatives for, let's decrease prescribing and let's monitor more closely. And what kind of was missing is, well, what's the alternative? Either to manage pain or backing up to prevent pain, or backing up even further to giving individuals skills in resilience and managing their psychosocial situations. And as PTs, it's not our sole area of practice, but we certainly get into that.
Yeah.
And so finding that these initiatives were kind of missing those pieces that I felt like we could bring.
Yeah, well, we're certainly getting into it more and more. It's a topic that we talk about on this podcast and others as well. So, the Choose PT campaign became quite popular.
Mhm.
And again, that's kind of like an alternative, so to speak. But I know the work that you've done in the curricula and with students has started to go deeper than that, than just as an alternative, so to speak. So
Right.
before the
Right.
opioid, you can do physical therapy, or instead of the opioid, you can do
Right.
physical therapy. However, I firmly believe, and I'd love to hear your thoughts on it, that the problem that has been created is so large that's going to be around for a couple of decades, that we're going to probably in our lifetime, in my lifetime,
Mhm.
we're going to have to deal with this problem, because addiction can be long and challenging and people can sometimes come in and out of it. So what's the role that you see as physical therapists in the opioid epidemic?
Well, this is where I love the Choose PT campaign. And I think it was slickly done. It was nicely marketed, and really gave a direction to point people. But I felt like it was limited. It was limited to predominantly musculoskeletal, predominantly come to PT instead of, but, again, seeing from my background with the cardiopulmonary folks, okay, we already have these people, we can't say prevent because they've already had some experience with opioids and they're challenged with that. So that's okay, what can we do to help people who are struggling with their abuse problems or their overuse problems right now, help them get into recovery and help them stay in recovery?
Mhm.
And that's, through healthy lifestyle, finding ways through using movement. That's our area of expertise, using sort of the movement medicine concept of, okay, I feel better because I'm not sedentary so much. And now I have feelings of accomplishment and self-esteem because I was able to get in better shape, or, I have skills to manage the pain that I can't completely get away from, but I know I'm not going to catastrophize and seek that escape
Right.
that, that the opioids tend to give you. So I think that was kind of the impetus for putting together the big table in that article, which really looks at stage of the opioid use disorder. So prevention, what to do concurrent with management of getting out into recovery and then maintaining recovery. And then breaking that down even further to look across common issues in lifespan, what are issues in children to elderly, and then looking at for our own physical therapy colleagues, bringing your area of expertise. So maybe you're a neuro sports kind of person and you love working with concussion, and a lot of your patients have post-concussive headache. Okay, so non-pharmacologic stuff there, plays a role in this whole kind of thing.
Yeah.
Or maybe you're a pelvic health therapist, and women who are pregnant have musculoskeletal stuff and postpartum, and then we can help to avoid going that direction.
I'm happy you mentioned that table because as I read the article, lots of great content, of course, in the paper. And then that table really stood out to me. And I think what you're saying is 100% true, that Choose PT campaign was very targeted toward musculoskeletal pain, traditional orthotherapists, which I think talks to a lot of therapists in general. But then you go through the paper and it's like, okay, women who are pre and postpartum may fall victim to opioid use or misuse. The elderly, children, like you really broke it down and said,
The
hey, this is
individual who's had a stroke and
right.
has, chronic shoulder pain, what kind of alternatives, those
Yeah.
kind. So
And I
just really
really,
try to think as broadly as you could.
yeah. And I really had a picture in my mind of, wow, all these different channels where someone could, without education and without help, think this is the only solution to my problem and therefore become addicted or potentially misuse an opioid. So I thought that was really powerful. And again, everyone can check that out in the 2021 PTJ article. And then, of course, the paper goes beyond prevention. So you're really talking about physical therapists having a key role in opioid use disorder, which hasn't been spoken about and hasn't been written about in the literature so much. Julia Shevin, I know you quoted her article. They started talking about it a little bit, but I actually think your paper goes a little bit deeper than hers does.
Yeah, and I think I have a colleague from many years ago who was in practice in rural West Virginia for a long time, and really understood the challenges of that. And then he ended up working in as a PT in an inpatient addiction recovery unit. And so working with him as one of the collaborators here, really saying, okay, what are you seeing?
Mhm.
What are you seeing as people come in, in that moment, and what things could they benefit from having a physical therapist? And yes, it's the musculoskeletal pain, but it's also the just overall deconditioning and the lack of understanding about pain, the pain science pieces. So all of that stuff that's in contemporary curricula, saying not just prevent, but if you're on it, or you're challenged with an unhealthy relationship with opioids, sorry, it's too far gone. I mean, I think there's still a role for us across that spectrum.
Yeah. I mean, it's really opening a conversation up because I think right now, if you ask a physical therapist, can I treat addiction? They would say, no, I don't treat addiction. That's not within my scope of practice.
Right.
And again, we don't diagnose addiction. that probably belongs mostly in the mental health realm. However, we know that the body impacts the mind.
Yeah, yeah. And I think that, the contemporary model of PT education is really working in that interprofessional team. And so while, yes, addressing addiction directly is probably in the mental health realm, if you talk to mental health practitioners, they will say, I need to get my patients physically active.
Yeah, yeah, it's true.
That's part of their mental health. And we can kind of go the other way. When you feel good, when you're moving, you're getting those endorphins released, your natural opioids, and, it works on the mental health as well.
Yeah.
Going back to working with some kind of challenging situations, one of the ones that I've been involved in quite heavily is working with people with cancer. So throughout their cancer journey, and even all of the opioid guidelines leave this group out completely. We should prescribe this, we should, unless you have cancer, and then anything goes. And there are no guidelines in there.
Right.
But we know in working in the field that not everybody who has cancer needs an opioid treatment. Maybe they don't. Maybe it's just a surgical recovery and get back to life. Or maybe they do, but can we minimize the usage, or can we, control that in some way? So that's kind of working together with the prescriber and managing pain, even in those unique situations.
Yeah, and I've actually I had a couple interviews just recently about mental health in rural communities, and I had a chat with Dr. Lillian Dindo. Everyone can go back and view her episode. She does small group ACT in the community in very rural communities. And after the podcast, her and I were chatting, and she said, we don't have enough mental health professionals in rural areas to treat patients. So even though we have this, what I really term, and you can correct me if I'm wrong, but it's a little bit idealistic that we're always going to have an interprofessional team, because sometimes that's not there in rural health, or it's not there based on insurance reimbursement. So a PT who's seeing the patient may be their only access to effective pain care, let's say. And I think the work that you have laid out in the article really helps a PT realize, wow, there's a lot that I can do without having to, quote unquote, diagnose the person as having an opioid use disorder and help them on the road to recovery, so to speak. I think that's really powerful in your paper.
Right. I mean, I think PTs for a long time are used to working kind of with pain medications, not just opioids, but any of them. Say, imagine, after surgery, it's like, okay, so you need it today. All right, do you need that tomorrow? Are we ready to go down on your dosage, or so those kinds of things as your body recovers. But I think especially the emphasis now on educating our entry level colleagues on some basic pain science. That's okay. That needs to be in every PT program curriculum. So, or strategies of motivation. So while we'll apply them to movement, they're not unique to movement.
Right.
So if people can learn some of these skills to manage their movement or their physical activity, they may find that, it also helps me set goals for healthy diet, or set goals for healthy relationships. And while we're not going to, we're not going to go outside our scope, a lot of the skills, once you learn the skills of resilience and goal setting and those kinds of things, apply across a lot of different issues.
That's right. I think physical therapists, we're getting better at it, but we don't realize the cognitive behavioral skills that we have. We can generalize that not just to pain, but as you mentioned, to other lifestyle conditions. And addiction in some ways may be, a lifestyle condition for some people. Right. Now, you mentioned the curricula a number of times, and you're a university professor for a long time now. I did a little bit of research before, just looking at CAPT, the Commission Accreditation for PT Education, going on their form, which is public. So if you go in there and you put in like keywords, opioids, addiction, opioid use disorder, nothing comes up.
I'm not surprised.
Right.
I'm not surprised.
I figured you wouldn't be surprised because you've done some research on this. If I type in the word pharmacology, it does come up as one of the 7 key elements of PT education practice, which is key. But when I kind of looked at it, it really was kind of written within the context of almost pharmacokinetics. So I wonder, and there was nothing under tests and measures, so screening for opioid use disorder, which
Right.
It sounds like there's a bit of that in your paper. So I'm wondering, we don't have a whole bunch with regard to pain education in CAPT. It's there, but it's kind of minimal.
Mm-hmm.
Do we need to include some information with regard to opioid use disorder in CAPT regulations?
I think you always run into a challenge with accreditation guidelines being sort of not being able to stay as current as
Yeah.
you might see in practice. For example, there's not going to be anything in CAPT guidelines about telehealth, but we got thrown into it.
Yep.
So I think as an educational program, you have to balance meeting those criteria that the whole profession has decided, okay, that's minimum. We need to meet those, but also responding to what's going on in your environment, in your society at that time. When polio epidemic came out, then everybody learned everything about polio. Now, maybe even not so much of an emphasis anymore, but we have to kind of to go with those trends. But I think one of the things I tried to do in the paper, our group tried to do, was to say, you don't need to create a new class on opioid use disorder, because you're teaching elements of this throughout the curriculum by meeting certain CAPT standards.
Right.
So I think that was my message to other educators. If you want to pull this together, don't worry about, having to teach a whole new thing, but providing this framework. You say, okay, trace this through, and then find, opportunities where you can use case examples or discussions or guest lectures or something to pull that stuff together, instead of saying we need to teach a whole new content and create another course. Our curricula are stuffed. We're dealing with the challenges right now of, the time that it takes to be a DPT.
Yeah, well, lots of content in there, and always challenging to pull something old out and put something new in.
Right.
One of the refreshing parts of your paper is you actually put this into clinical practice. So your students went out into the field and did some community outreach projects. I believe that was part of their affiliation, their internship.
Yes.
Can you talk to us about that and maybe tell us a couple of those projects that stand out to you that were well received by the student physical therapists as well as their CIs?
Our students, for one of their rotations, because we are the West Virginia University, so we're funded by the people of West Virginia. One of their full-time clinical rotations has to be in a rural community. And so that had been established for a long time. And they also had a requirement of doing some kind of community education project. So we really pulled what was existing, and again, not creating a new thing that students had to do, but let's just take what you already have to do and see if we can match with your interests and your community's needs to say what piece of this puzzle might fit for where you are in your community and your interest level. So unfortunately, the rollout of this coincided with COVID, but our students and their clinical instructors are very creative, and a lot of this happened virtually, as opposed to go to the senior center and talk to a group of 30 people about fall prevention. And, if you don't fall, you don't have injuries, you don't have pain, you don't get on opioids. So it became a little more creative to try to do that. And, they were able to put some information on a clinic's social media site. There was a lot of interest in some of the unique pieces, like a prenatal exercise class for teaching moms how to not only exercise safely now, but how to manage their babies so they don't have pains and those kinds of things. Early mobility programs in a more critically ill population or in ICU survivors, how to use movement as pain prevention. So they're a very creative bunch. And with the guidance of clinical instructors living in those rural communities and knowing what some of those challenges are, I think they're putting together some really nice projects, but we'll be yet to see. That's still ongoing right now.
Yeah, it was great to see that in the paper, that you're taking that from the academic setting and it's going right into their clinical internship, which is really great. And I would love to even talk to one of them on the podcast and see what their experience is with bringing that to the clinic, knowing that it's something new,
Mhm.
yet it's something probably meaningful and important to them as citizens of West Virginia. So I think it's just great work. And that's why I wanted to invite you on this week. And it's been great talking with you. And I'd love to hear any plans of what you plan on doing with this work in the future, more papers or more studies or deeper studies. And of course, let people know how they can continue to follow your work.
Yeah, so we've been very fortunate that the work we've done so far has been funded as part of the state opioid response grant, which every state receives some degree of federal money to help roll out, address this problem. So our state health department solicited projects, and they thought this was a unique one, predominantly because we were about the only ones addressing prevention. So I think that's a hook to kind of to get in there and to get more PT colleagues sort of at the table with those discussions. I think some of the challenges that we'll have coming out of this is figuring out how to document whether we're being effective or not. How do you document prevention of opioid use? It's a little more challenging, but I think you can look at things like, are you driving any traffic and direct access to local clinics, people hearing about this? Are PTs then being represented on various teams that are looking at addressing the opioid problem in communities? So I think that's kind of yet to be seen. So as we look at the feedback from our students who've rolled out this first stage of the project and see, okay, how were they received? What kinds of audiences seem to be receptive to this or not receptive to this, in what kinds of formats? Hopefully we'll at least be able to put out some of those sort of examples of projects that we've been doing, that our students have been doing with that. I think, well, everybody's focus obviously got diverted to, the pandemic and what is COVID and what's happening with us. As we begin to see a light at the end of the tunnel of that and coming out of this epidemic, I'm unfortunately thinking that the opioid use epidemic is going to be even worse than it was before. I mean, I think the social isolation is a big issue. And, if you start with individuals who are dealing with emotional pain, and that's why they have a tendency to seek the escape that they can get. I think that, unfortunately, may be even more of a challenge.
Mm-hmm.
And then even in the COVID survivors, I've seen recent uh, literature showing that somewhere between 10 and 20% of COVID survivors who went home were on opioids. And, we're continuing to be on opioids long term. So there's even an issue potentially there in that population. So even that's beyond where we were in putting the model together, is looking at a whole new population that, can use as we help them recover their physical function and mobility and decrease their pain and anxiety and all those things that we can do.
Yeah, really well said. The awareness that has been raised around the COVID pandemic and opioids, both prescription and illegal drug use with regard to it, is
Mhm.
it's there, and the research is building, as you say. And it just might be that we're well poised, and we've have some experience based on some of the literature you've done, some of the work all of us have done in practice, that we can say, hey, before this gets out of control, let's intervene with effective pain education, with physical therapy,
Right.
with the promotion of physical activity and healthy lifestyle for those to recover. And if they have to be long copers of COVID, which some people are,
Right.
then we have a place at the table for that, definitely, without a doubt. Just like, as you mentioned, previous pandemics, physical therapists were there in force to help people. So they're all
Right.
really wonderful points. And as your work develops, please come back and update us on it, both here on the podcast, and just share with me. I'm always sharing interesting things on social media that people click on and link to. And it's been great chatting with you. How can people reach out to you in the future?
So anyone who's interested in this can reach me at West Virginia University. My email there is aswisher@hsc.wvu.edu, and I'm sure you can put that in print somewhere. People can reach out to me if they're interested in learning more about what we're doing or continuing that conversation.
Great. So again, make sure to check out the paper in the 2021 Physical Therapy Journal. The title of the article is called Physical Therapist's Role During the Opioid Epidemic in Rural Appalachia, Preparing Students to Educate Communities. I'll link to it in the show notes. And of course, I'll link to Professor Swisher's email in the show notes as well, which you can find over at the Integrative Pain Science Institute. At the end of every podcast, I ask you to share this information with your friends and family on social media. That could be LinkedIn, Facebook, Twitter, it could be a Facebook group, wherever anyone is talking about the effective and safe treatment of chronic pain, opioids, and opioid use disorder. I'm Dr. Joe Tatta. Thanks so much for being here with us this week, and we'll see you next week.
Thank you for listening to the Healing Pain Podcast with Dr. Joe Tatta. To subscribe to the podcast and learn more, visit integrativepainscienceinstitute.com. That's Integrative Pain Science Institute.com. Sign up to receive weekly updates, leave a review on iTunes, and share this episode with your friends.